So I always tell parents, if you're worried, we want to hear about it. Even if it's just a matter of wanting to check if something's normal or not, or having more serious concerns or significant concerns. If something's been on your mind, don't hesitate to bring it up to your doctors or your nurses. The way it works is that most parents will have a first meeting with their family doctor. And so if you are concerned about possible ADHD, I encourage you to make an appointment with your family doctor for a checkup to discuss those concerns, or you can bring it up at one of their regularly scheduled appointments. It does sometimes take a little bit of time to have the discussion about ADHD, so sometimes it's a good idea to have a specific appointment for that. In terms of ADHD specifically, sometimes parents are told that we can't make a diagnosis before a kid starts school, which is actually not true. We don't make a diagnosis before kids are 3 years old, because before that it's tough to know what's just a normal rambunctious toddler and what is something more significant. But once a child turns 3, we can start to do an assessment for ADHD. That may look a little bit different depending on how old your kid is. But like I said, the first step is to make an appointment to discuss some of your concerns. And if you do have reports from daycare or from school, like report cards or verbal documentation, or even things that your teachers have told you about your kid, it's always super helpful to get additional context. When we think about ADHD, we talk about a couple of different symptoms, but the main ones are hyperactivity, which is where your kid always looks like they're driven by a motor, never stops talking, never stops moving. Impulsivity, which is when your kid does things without thinking. So that can be blurting out answers, having trouble waiting their turn, running across the street without looking both ways. And then the final kind of main symptom of ADHD is inattention, which is the daydreamy kind of difficulty paying attention over the course of a conversation, forgetfulness, absent-mindedness. Your kid can have any combination of those symptoms, and it may be ADHD. It may just be normal kid behavior. Those are the big symptoms of ADHD. We, as doctors, start to consider a diagnosis when those symptoms are excessive. So they are to an extreme amount, more than we would expect for a typical kid. They're persistent, which means they've lasted for a long time. So it's not just a month or two, maybe because of different things going on, where your kid's a bit more energetic or having a harder time paying attention. But for it to be ADHD, it really has to last a long time. And then the final kind of thing we consider is whether the symptoms are pervasive, which means they happen in all sorts of circumstances. So it's not just school, where your kid has a hard time sitting still or paying attention. It's school and home, activities outside of school or home as well. Maybe to different degrees, but we want to have at least a sense that whatever main symptom it is, hyperactivity, impulsivity, or inattention, it is excessive to some degree, persistent for sure, and then present in multiple different environments. And so if you do have any of those concerns, like I said, first step is to make an appointment with your family doctor or your nurse to discuss those concerns. Depending on how the conversation goes, and as I mentioned, if you have information from school or daycare, always super helpful to bring that along with you. Your family doctor may set you up either with an appointment with a pediatrician like myself, which is one way that we can go about making a diagnosis of ADHD. A lot of folks that I've met through starting to work at Kateri also get a diagnosis of ADHD through meeting with a psychologist, either through KEC or going privately through Jordan's Principle. Now, any of those ways is a valid way of making a diagnosis of ADHD, and the path that your kid may choose can be a little bit different depending on the different circumstances. At that initial appointment with your family doctor, they will likely give you a referral, either to meet with me, the pediatrician, to meet with one of the psychologists, either privately or through KEC.
Once you have a diagnosis of ADHD, what are the treatment options available to children?
So when it comes to treating ADHD, I think it's really important to start off by saying that we're not looking to cure ADHD. ADHD is not a problem that needs to be cured. ADHD represents, in my mind, in my perspective, and I think for most people, an extreme end of traits that we all have, in terms of paying attention, in terms of our energy level. ADHD describes people who are at the extreme end. And, in certain cases, in certain situations, that is a good thing. If you've got lots of energy and you can channel it to, do sports or into an activity that you really love. And so we're not trying to get rid of ADHD. What can happen for kids and adults who have ADHD is that those symptoms, those traits, can get in the way of functioning well in some other important areas, like school, for example. When it comes to treating and managing ADHD, we try and find different strategies that are going to make it so that your kid is able to meet their full potential and succeed in all the different areas of their life. When it comes to the different treatment options, I think first and foremost, it can't be understated how important the basic good living strategies are. So getting a good night's sleep as often as you can, eating regular balanced meals throughout the day, and then doing physical activity regularly, particularly for people with ADHD. Physical activity, a way to burn that extra energy or have something to really focus on, can be really helpful in channeling and managing those symptoms. So first and foremost, good advice, I think across the board, whether you have ADHD or not, but definitely important for kids with ADHD. There are both medication treatments and non-medication treatments that are important. And I know we'll talk about medication treatments later. So thinking about the non-medication options that you have, there's lots of different things that can be done. And I think all of these approaches can be helpful, and especially combining different approaches. So for example, academic support can be really helpful for kids with ADHD. In school, they may benefit from a little bit of extra attention, placed in certain places in the classroom, like close to the teacher, or close to other kids who have an easier time focusing. They may benefit from getting extra support or tutoring or one-on-one work. What I usually recommend for parents whose child has been diagnosed with ADHD is to share the diagnosis with the school. Often in the form of a letter that you would get from me or from the psychologist who does the diagnosis, so that the school can then incorporate that into an individualized education plan, which is a document that helps teachers and administrators just take into consideration that your child may have unique aspects to the way that they learn best, and to incorporate that through their academic career. Other treatments and approaches that can be helpful for kids with ADHD is just in terms of thinking about how we communicate, how we parent. For kids who have a harder time focusing or have more energy level, sometimes just the way that we communicate in terms of giving them chores, giving them instructions, giving them information, making small, subtle adjustments that may not feel totally natural at first can actually have a big difference on how a kid gets through the day and having a more harmonious life at home or at school. And so that is certainly, doesn't sound like an intense sort of treatment the way that we usually think of, but it can make a big difference. And during appointments with the pediatrician or the psychologist, we can talk about different resources that might be helpful. Another treatment or therapist that can be helpful for kids who have ADHD is working with an occupational therapist to work on planning techniques, visual schedules, organizational skills and techniques.
When is medication recommended as part of ADHD treatment?
Medication is something that I think a lot of parents, a lot of people have heard a lot about. They may have had personal experience or family experience, both good and bad. And so the medication conversation is an important one. I think it's important to say straight up that even if you have a diagnosis of ADHD, medication is not mandatory. It can be helpful. We've used the medications for many, many years, and they can be really effective. But just having a diagnosis of ADHD does not obligate you to start medication. It can be a conversation, and it can be an evolving process. If you want to try medication, it may be something that we give a shot and see what happens. We can take breaks, we can start again. And so I think, I really want to make it clear to families that medication is a discussion, and finding the right medication and finding the schedule that works for you and your child is an important part of the treatment of ADHD. I like to think of medication as a tool in the toolkit. We talked about the different approaches, the different therapies, the different treatments for ADHD, and I like to think of medication as part of that. it by no means replaces those other treatments. And like I said, it can work in addition to those other treatments. I think the more that we're able to put in place for your child, the better. When it comes to a child who might need medication, typically, the discussion that we're having is that we've tried a few different therapies, we've tried different approaches, how we communicate, maybe working with the school, maybe working with an occupational therapist, and your child is still having difficulty with their energy level, with their impulsivity, with their attention, and not meeting the potential that we know that they have. Medication can be a useful boost to the other treatments that we're using. And so that's where we might start to recommend a trial of medication.
How do ADHD medications work, and what types are commonly prescribed?
So we've used stimulant medications for many, many decades, and we consider them extremely safe in the doses and the formulations that we prescribe. ADHD medications, the stimulants, can be really beneficial, and they tend to work well for most kids, although it's important to note that not all kids with ADHD will respond to stimulants in the same way. The stimulants work by increasing the level of two brain chemicals, dopamine and norepinephrine, that are important in regulating your level of alertness, your memory, your mood, your energy level. So by taking these medications and increasing the levels of these two brain chemicals, we can increase your overall attention, your focus. We can decrease some of that hyperactivity, that restlessness that we see in certain kids with ADHD. There are lots of different stimulants available, and a lot of the names are familiar to people: Ritalin, Adderall, Concerta, Vyvanse, Dexedrine. In fact, within all of these different medications, there's actually just two stimulants. But the different brand names, the different names that you've heard, refer to the differences in how they're packaged, how they're formulated, how they are released, how long they last. And so within the group of stimulants, we've got lots of different options that are available. They all tend to work very similarly, but there's different nuances, which leads to some kids responding to one stimulant very well and maybe not responding to a different one. So sometimes as we're starting a trial of medication, I like to tell parents that there can be a bit of trial and error that comes about, and to just be prepared that we may start with one, we may try and increase it a little bit, but depending on the effect that we're seeing, the side effects, it was an ongoing discussion about whether the stimulant that we start with is the right choice for you. There are a couple of different non-stimulant ADHD medications that work a little bit differently than the stimulants. They can be a good choice, either as an additive on top of the stimulant that you're taking, or as a replacement if you're having significant side effects, or if there's other considerations about your child's health. These are medications that can also work really well. Typically, it's a discussion with a pediatrician if the stimulants aren't working the way that we expect to add these non-stimulant medications. But they can be effective, and so sometimes when I see a child, they may have tried a stimulant medication, maybe even a couple stimulant medications. And I know it can be very discouraging to put yourself out there and try those medications and not have the response that you're expecting or hoping for. But I like parents to know that there are lots of different options. And during appointments with your pediatrician, with your doctor, you can discuss these different options and what might work best.
What are the potential side effects parents should watch for?
A couple really important side effects that it's important to know about before starting the stimulant medications in particular. The two big ones that I tell every parent when we're starting a trial of stimulant medications is appetite suppression and maybe some difficulty sleeping. The appetite suppression is a pretty universal side effect from the stimulant medications. Again, different kids will respond a little bit differently. Some maybe have a bit more appetite suppression than others, but it's a pretty common side effect. And it can be pretty scary for parents to see when they send their kids with their lunch and it comes back half-eaten or even not eaten at all. One of the worst feelings that we can have as parents is feeling like our kids aren't growing, our kids aren't eating. And so it's really important, to talk with your doctor about this potential side effect ahead of time. This is something we watch really, really closely. And while we expect a certain degree of appetite suppression, we want to make sure that our kids are still eating, that they are still growing. And so it's something we follow really closely, especially as we're starting a medication and we're adjusting the dose. If we're finding that the appetite suppression is so significant that a kid isn't growing as well as they should, that's when we often have a conversation about different options that we could try or adjustments that we can make, what we're using in terms of the medication, as well as other factors that we might be able to play with to try and balance out that side effect. But it is an important one, and I think any parent that's considering medication for their child should know about. If you're being followed by a doctor, we can make sure that even if your child is experiencing the side effect, we can dose these medications safely so we can ensure that they're still going to grow and not go hungry. Other side effects that I like to talk to parents about are that because these medications make you more alert and focused, if you take them too late in the day and you're on a longer acting stimulant, it can make it a little bit harder to fall asleep. Although interestingly enough, a lot of kids with ADHD will have trouble falling asleep anyway, so that's something that we can talk about in our appointments and how we balance that. And then other side effects that I'd like parents to know about, especially because there's lots of opinions and lots of stuff that you'll hear, from people or online about these medications, about being turned into a zombie or being really flattened. And I'm not going to tell you that that's not a possibility. If that happens for your child, if you think, we start a medicine and they're really not like themselves, they're really flat, that tells me it's not a good choice. And we can have a discussion about changing to a different one. It can be a little bit freaky to give your child a medicine, and because they work relatively quickly, see sometimes what is a pretty significant change in how they're acting during the day compared to how they're usually acting. And so it's an important discussion point as well with parents when we're going through these medications and talking about the different options. But I don't want to turn your kid into a zombie. I don't want to take away the things that make them who they are. And so, again, part of having your appointments with your doctor and with a pediatrician is having this discussion and talking about, what to expect, and, maybe trying a few different options until we find something that, is able to benefit your kid without turning them into someone that you don't recognize, or, taking away the things that make them special. That is not what we want to do with these medicines.
How long does it typically take to see results from medication?
This is one of the nice things about the stimulant medications in particular, is they actually work pretty quickly. Within, half an hour to taking a stimulant medication, you may already start to notice a difference or feel a difference if you're the one taking it. That can be helpful because one of the options with stimulant medications is taking them when you need them. So taking them on school days, for example, but on weekends, on holidays, on summer break, when it's not as important to have a certain degree of focus or attention, you don't have to take the medicine, and it will still work well if you take it on school days when you restart. So that's one of the nice things about how quickly these medications act on the body. And so we should know pretty quickly within a few days, a couple of weeks, once we start a medication, if we've got a good dose or if we found the right choice for your child. I always like to start with a low dose, so as to try and avoid too many side effects as we're getting used to this new medication and this new routine. But over the course of follow-up within a couple of days to a couple of weeks, we should have a good idea if we're getting a good effect from the medicine and how much the side effects are impacting your child. If we're finding that we need a higher dose and we're not having too many side effects, we can go up incrementally, even every couple weeks or every month or so. We can do this with follow-up appointments with your doctor, but your pharmacy as well can be really helpful to making these small adjustments on the dose. And so as a parent, if your child has started one of these medications, keep an eye on how they're doing. Ask them about it, keep an eye on how much they're eating, and within a couple days to a couple weeks, if you're feeling that they may need a bit of an increased dose or it's not working as well, or on the other hand, if they're having too many side effects, don't wait. Make a call to your doctor, go into the pharmacy, and see if you can make an adjustment.
Can children grow out of needing ADHD medication, or is it often long-term?
We consider ADHD to be a lifelong diagnosis, but I always tell kids and parents that the symptoms we see right now may not be the symptoms we see in 6 months, a year, 5 years, 10 years, 20 years. What happens with ADHD often is that as kids grow up, they learn to manage their symptoms. That's why it's important to incorporate these different strategies like communication, like organization early on so that we can build skills that kids can use for the rest of their life. What we sometimes see is that as kids get older, move into their teenage years, adulthood, they may have developed enough of these skills, they may know themselves well enough that the medications aren't needed anymore. And so it is absolutely totally reasonable to think that there's a possibility of coming off the medications. It's going to depend on each kid, each situation, about when that might be, and it would also be totally okay to stay on medications long-term as well. It's going to be different for every kid, but it's certainly possible to not need medications. Maybe that's for a short period of time and you restart later on. It's all possible, but I think it's important for parents to know that if we do start a medication, especially when kids are young, it doesn't necessarily mean that they're going to need it for the rest of their lives.
How should parents talk to their child about starting ADHD medication?
This is going to depend a little bit on how old your kid is and how they understand, the conversations that are happening at the doctor's appointment. My general recommendation is to be as honest and upfront with your children as possible. Explaining it in ways that a child, depending on their age, is going to be able to understand. As a parent, I can certainly understand not wanting your child to feel ashamed or to feel different when it's so important for kids to fit in, feel like they're part of something. But by being open and honest about an ADHD diagnosis or why a child might be taking medication, I see it as a way to empower a child, have them feel like they have some control and a part to play in this, because they definitely do. And as they grow up, it's going to be important that they learn to advocate for themselves and learn what they need to feel their best and perform their best. So depending on how old your kid is, the words that we can use can sometimes be different. I like to, for younger kids, talk about this medication as a tool. And again, the specifics of your child's situation, how often we're taking the medicines, what medicines we're going to take is going to be different. But working together, we can find a way of bringing your child into this discussion as opposed to keeping them separate and not sure about what's going on.
What should parents do if they feel medication isn't working or is causing issues?
If you, as a parent, are getting the sense that this is not the right medication for your child, the side effects are too intense, it's not having the effect that you expected that it would, do not hesitate to call your doctor and set up an appointment or a phone call to discuss these concerns. If you're really, really worried about the effect that the medication is having on your kid, and let's say you can't get in to see the doctor or the pharmacist right away, it is also A-okay to just take a break from the medicine and then talk about that when you are able to have an appointment with your doctor.
How closely should children on ADHD medication be monitored, and by whom?
When we are starting a medication for a kid with ADHD, like I said, I usually try to start with a low dose and then go slow and slowly increase until we find a good balance between the beneficial effect and making sure that side effects are minimized and controlled. And so the first couple visits tend to be a bit more frequent as we're making adjustments on the medication. And of course, your pharmacist can help with the adjustments as well. Once we find a stable dose and your child is doing well, we may be able to stretch the follow-up a little bit more. That isn't to say that we should only be watching these things at doctor's visits. It's really important at home and at school to involve your child's teachers, to involve your child's relatives, to keep an eye on how they're doing. Because if something changes, even if at their last doctor's appointment, everything was going well, the medication was working well, we were really happy, if something changes between your doctor's visits, you don't have to wait, make that call, but it's important to recruit other people in the child's life to keep an eye on these different things, how they're doing, side effects, and all that. And if there's any concerns at all, don't hesitate to phone your child's doctor.
Are there risks of dependency or misuse with ADHD medication? How are these managed?
What's really interesting, because we've used these stimulant medications for decades, and we've been able to see the effects that these medications have on kids and adults who take them, what's really interesting is that overall, kids who've been diagnosed with ADHD who take stimulant medications, we often see that they have lower rates of substance use, lower rates of accidents, both car accidents, broken bones, things like that. With these medications, the stimulants, while they are controlled substances, you need a prescription for them. And the doses and formulations that we prescribe are not considered addictive, and it is safe to start and to stop the medications. Of course, you want to do this under the supervision of your doctor and your pharmacist so that we can collaborate on the best care plan. The risk of harm and dependency, we really don't see that with the medications that we're using.
What would you want more people to understand about ADHD and ADHD treatment?
I think there's a couple things that I would really like more people to know and to hear. First of all, ADHD is not because of bad parenting. ADHD is a difference in how the brain works. It's also highly genetic. Even if we can't have a blood test or genetic test for it, we know that it tends to run in families, and it's very, very common. Another thing that I think it's really important to know is that every child is different. What works best for one child may not be the best treatment for another child. And so while it's really easy to compare and to get advice from different people and online and look at those different things, working with your doctor to find the treatment plan that works best for your child is the best thing that we can do for your kids. And I think the last thing that I really want parents and caregivers to hear is that, getting a diagnosis of ADHD, starting medication for ADHD, again, is not a failure of your parenting or of how you've raised your kids or how you've taken care of them. This is a really common diagnosis, and I hope parents know that, advocating for their child, making the appointments with their doctor, looking into why your child may or may not be having difficulties or differences in how they're doing is actually one of the best things that you can do for your kid. Being that advocate, being that protector, getting them the support that they need. That might include medications, it might not. It can be a discussion with your doctor. If you do have concerns, don't be shy, don't hesitate to bring them up with the people that help to look after your kids, their doctors, their nurses, their teachers. You can do a world of good that way.